Welcome to Medcast. Here, we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. I am Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai, and my guest for today is Mrs. Kirsten Jackson. Mrs. Kirsten Jackson is a registered consultant dietitian specializing in irritable bowel syndrome. She graduated from Hertfordshire University, UK in 2012 and has spent her career specializing in irritable bowel syndrome, which is a condition close to her heart as she also suffers with this. Outside of clinical work, Kirsten is an advisory board member for the Irritable Bowel Syndrome Network, a leading UK charity, as well as Forbes Health. And earlier this year, she had her book, Take Control of Your Irritable Bowel Syndrome, published by Bloomsbury, which is now available worldwide. Kirsten, I am really privileged to have you on Medcast today. It's going to be a very interesting discussion about irritable bowel syndrome, which I think, especially in the region, a lot of information are lacking. Many people have it and they are not diagnosed or even underdiagnosed, and they are suffering. And as we know, this can lead to serious health issues. So I'm really glad that you are with us today. And as a start, we usually ask our guests to tell us a bit about their journey. So yes, the mic is yours.
Thank you so much for having me, Dr. Wafaa. It's an absolute pleasure to be here and, get that information across. So for those people who don't know of me, as you said, I'm an IBS consultant dietitian from the UK originally, but living here in the UAE for the last 8 years. So I've been in the Middle East for quite a while now, which has been a fantastic experience. So I specialise in people with irritable bowel syndrome. So we look at a variety of areas within their diet and also their lifestyle, just to really home in on what's going on in their gut really and get it functioning better so they can live a relatively normal life, because it really is an awful condition.
Okay, great. So to start with, tell the people, what is irritable bowel syndrome?
Such a fantastic question, because so many people use IBS or irritable bowel syndrome terminology just to, describe a range of symptoms. And actually it is a real condition with a real definition. And it's very important that we know that and we understand, what it is really. So the easiest way to explain it is to start to talk about something called the gut-brain axis. So the gut-brain axis is basically this pathway between the gut and the brain, and because they like to talk to each other. So if anyone's ever experienced, butterflies in their tummy when they get excited or anxious, that is your brain and your gut talking to each other. And this is very normal. But in IBS, your gut and your brain, they don't talk to each other properly. So you can end up with a range of symptoms, maybe if you're eating just normal, what we would consider healthy food. Or perhaps you are maybe in a traffic queue and trying to get to work and it's a little bit stressful. You might end up with a lot of digestive problems from that, because the gut and the brain are not talking to each other, let's say politely, because the different pathways, whether it's hormonal or the nervous system or even the microbiota, all these things I'm sure we'll come on to, they're not functioning properly, unfortunately, in somebody with IBS. Now, IBS, it can cause a range of symptoms, so things like bloating, pain, constipation, diarrhea, which are very, very common. But this is not just something that happens maybe once in a blue moon or once every so often. It's a chronic condition. So to get a diagnosis, somebody does have to have had those symptoms for at least 6 months, with the symptoms occurring once a week more recently. So it's something that's ongoing, unfortunately.
All right. Great. So this is a good start. We knew now what is irritable bowel syndrome, or what we call also IBS. So if we use the term IBS during the discussion, the listeners and the audience will understand. So coming to gut-brain axis, this is also a very common terminology in pediatrics, because, as I'm a pediatrician, and we have these functional GI disorders in newborns and infants, where also colics, for example, in the newborns is always related to this gut-brain axis, which is coming more and more now to the surface. And there is also a brain in the guts. There's another brain in the guts. There are 3 brains, they are saying right now. The brain which is in our head, the brain in the guts, and the brain in the heart. So very interesting, this irritable bowel syndrome. You said these symptoms, you mentioned these symptoms that people can have. So how is it diagnosed? If people are having these symptoms, they can come to a clinical dietitian, or they can go to the doctor, gastroenterologist. What's your advice to the people if they have these symptoms?
Yeah, great question. Because whilst we talk about some of the symptoms there, the constipation, the diarrhea being common in IBS, and IBS does impact 1 in 10 people, So it is common. You cannot diagnose the symptoms alone. You do need to go to your doctor. So the first person really is just a family medicine doctor, because they will assess not just this, but they will also look at other areas. Because whilst these symptoms, as I said, can be part of IBS, it could be part of also having a gynecological problem, or something like celiac disease, which is another gastro problem, or inflammatory bowel disease, or even sometimes, unfortunately, even bowel cancers. So this can often be missed if you think, oh, it's probably IBS, you must go to your doctor. So family medicine doctor will do their first line testing. If that comes back negative and you fit the profile for IBS, you can get given a diagnosis then. But if they have any other concerns, if there's anything else going on that maybe doesn't quite fit, then they might then refer you on to a gastroenterologist just to confirm that diagnosis.
Great. So it's a diagnosis of exclusion.
Exactly.
So after we make sure there's nothing else going on from the, let's say, other diseases which are really serious, we go to the a diagnosis of irritable bowel syndrome. And here comes your role probably, because we know that diet plays a major role in irritable bowel syndrome, and you have a big training in this field. So tell us more about the diet and its role in helping or probably triggering irritable bowel syndrome.
Yes, absolutely. So there's two roles of the diet in irritable bowel syndrome. So we can look at to see what is triggering symptoms. And this is kind of the lesser role, which surprises people, because people think, oh, if I can just find that one food that's causing all my problems and I can just avoid that one food, everything is going to go away. But actually, there's a second role also where we need to actually use food to build the gut back up again. Because if you are not digesting things like wheat or onions or garlic or other common triggers, it's normally because your gut microbiome, your gut sensitivity is not functioning properly. So we can use food and bring food back into the diet. So things like different types of fiber, content, making sure someone's drinking enough fluid, even the types of fluid that they're drinking as well. So it's all quite specific, the times of the meals, and making sure we're not overeating or under-eating even. All of these elements can play a factor. And unfortunately, there is no one-size-fits-all approach. We can obviously start with what the research is saying, and then we really need to tailor it to that person. So ideally, what we're trying to do is not just put somebody on some crazy restrictive diet because their gut's so sensitive it just can't digest anything. We're trying to build up again by bringing in foods that we know are good for the gut, step by step, and then that should help them actually eat a relatively normal diet. But mostly plant-based is what we're trying to aim for, because we know that plant-based diets that include a lot of variety are very good for the microbiota and how the gut functions. So probably lots of points to, touch on there. And even there's some areas that we maybe need to avoid. So things like caffeine, I know, especially in this region, all my clients drink coffee all day long. It's very social. We use it to stay awake, work longer hours. But it is a stimulant, unfortunately. So that can impact the gut. Depending on the person, they'll have different tolerance levels. So lots and lots of things.
Yeah, it's a long journey, I think,
Yes.
for the patients with irritable bowel syndrome with their dietitian. So like personalized treatments, right? Personalized dietary plans are needed because each person is different. This is what I understand.
Absolutely.
And how does this start from you ask the patient to write, to document, to make a diary about how do you reach the conclusion that this food is good for him or not?
Yeah, good question. Because even if somebody said to me, oh, what food do you think is causing me a problem? And I'm a specialist in this area, I'd say, oh, I have no idea. We need to document and track over some time. So typically when I work with clients, I'll ask them to keep a diary for 1 to 2 weeks before they even start. And they need to be tracking everything they're eating, everything they're drinking, the symptoms, but also looking at their stress, their sleep patterns, their movement, what else they're doing, medications they're taking. Because sometimes people can look at their diary on their own and they can get quite in a situation where they're not eating anything, because every time they have a symptom, they think, oh, it's that food that's just caused the issue. But actually, it might be because they were really stressed that day and that's caused the issue. And foods can have a reaction up to 48 hours after we eat them. So they're quite difficult just to track on their own. We need to look at all the factors. And typically what we would do is then look at all the factors, have a baseline, and then do something called the low FODMAP diet, which is a diet where we exclude the sort of common triggers initially to get rid of all the symptoms. And then we confirm what that intolerance is by very sort of step by step bringing back these foods in. So we can see very clearly, okay, so they had bread, now they're having symptoms. And we can then say to them, okay, now you have an issue with this food. So it is not easy, and that's why people find themselves in such a pickle, which is a very British sort of term.
Yes, so much there.
Yeah.
And in the region, to go back to the region, are there a specific food for our region that can trigger irritable bowel syndrome different than other areas of the world?
So yes and no. I think with everyone, there's sometimes a cultural kind of barrier, I guess, where we feel like, oh, we don't have that specific diet, so we can't follow it. But I think ideally what we should be following is what we call the Mediterranean diet, which is more it's based on people who are around the Mediterranean region. However, even with like an traditional Arabic food, we can still tailor that to be Mediterranean. And what that means is looking at whole grains. So looking at our breads, how we can actually, instead of just using white flour, which is not great for our guts, actually can we make them with whole flour? And many people here, they do have chefs and cooks at home. So it's just simply asking them or giving them a recipe to adapt that. Looking at vegetables, it doesn't always have to be specific. It's just eating more of them. So it's just about tailoring it with that. But I think probably the main issues are around Ramadan. Obviously, we have Muslims all around the world, but it's obviously in the Middle East, there's a higher proportion of Muslims. So I would see more Muslims during Ramadan who have issues there just because of the long fasting periods, which can disrupt the gut. But then when we then break fast, we're normally really hungry and it's a social period as well. So we're typically eating large portions of foods and maybe richer foods than we would do normally because it's a social occasion. So that can cause more issues. But again, doesn't mean that you then have to just suffer all of Ramadan. There are things that we can bring into place so you can enjoy Ramadan and, and have that good time as well. So it's one of those cases, yes, there are specific triggers. However, everything can be tailored. It's not a case of, you can never eat your traditional food. You are unable to fast during Ramadan. That's not the case. It's just about making small changes. That's all.
All right. Nice. Great explanation, and I think so. Being followed by the dietitian will help a lot in this. Because life is every day you have new things, so there's always changes in this life. And coming back to the other part of the problem, which is the stress and the lifestyle, probably circumstances that can occur to any human being. So, how, as a dietitian, you are able to manage this part, or do you get some support from our friends in the mental health sector, psychologists, psychiatrists? Do you refer your patients there?
Yeah, good question, because IBS, it's a grey area, isn't it? There's a bit of nutrition, but there's some medical in there, there's some psychological issues, and even exercise. I'm not an exercise expert. So with the mental health side, we'd always ask somebody to track it themselves, and we always ask someone's past medical history. So are they taking antidepressants? Do they have depression, anxiety? And then we look to see how severe the symptoms are. So it is, again, on a case-by-case situation. So if somebody is just dealing with day-to-day stress, and we might just advise something like meditation and guide them through that using one of the evidence-based apps that you can now download for your phone. But if someone's really suffering, then something like cognitive behavioral therapy, which is done by a trained therapist, would be really useful alongside it, because that can target the gut-brain axis specifically. But then you can say, again, some people find it too much to do the diet and lifestyle and therapist. So again, it just really depends on the person. Occasionally we do have people with IBS who've also got, sadly, an eating disorder, because those two conditions are very common together. In which case we'd always work alongside a doctor and a psychologist and a dietitian as a team approach, just to make sure we're helping that patient. We're not making, further issues with it. So yes, sometimes someone will need more support. But I think with a therapist, and this is what I wrote in my book, people will often say, when is it right to see a therapist? And really, there's no wrong time. It's not, you can never see it too early. There's never going to be a case where you don't need to see someone. So if you have, the financial resources to, or it's covered on your insurance, and you have a gut problem, just book in. It's not going to do any harm. We know it's going to be beneficial. So yeah, if you can, I would suggest it would be useful.
Yes, of course. And the thing is that sometimes also when they come to you, do they have also like weight problems? Usually irritable bowel syndrome patients, are they obese or slim, or their lifestyle in general is usually healthy, or like sedentary lifestyle, if we can say?
Yeah.
But from your observations, let's say.
Surprisingly, both. And I think, unfortunately, with people being overweight, there is a stigma attached to that. So some of my clients have gone into the doctor, unfortunately, and been told, all you need to do is lose weight, which is not helpful. But we know that people who are overweight have got a different microbiome, which is maybe not as good. However, the issue is is if you're trying to lose weight, you need to exercise more, you need to eat a diet which is lower in calories, which is this high fiber diet. And if you have IBS, that can be really difficult for you. So I don't think IBS causes somebody to be overweight, but for sure, being overweight is becoming more common. It is an issue. It's difficult to manage on your own, and especially having IBS, and it's very tricky. So I'd say work with a dietitian, but equally, we see people who are underweight, and they're doing things like they're using extreme exercise to manage their stress levels because we're told exercise more and more and more. Or they're doing things like drinking 4 litres of water per day, which we're told drink more water, it's good for your gut. But this can actually worsen things and make you feel very bloated. And if your body weight is actually quite low, then we know that this can cause constipation to quite a severe point. I think there's some research out there that shows if you're having 1,500 calories or less per day, which is what I often see on social media that's, advised for people, that actually this is more likely to cause constipation. So it swings in both ways, and then you become feared of food as well. If you are looking at your diet and you already don't have maybe the best appetite, you're underweight and you need to gain weight, why would you want to eat lunch if you know it's going to cause you pain and discomfort? Yeah. So it becomes this kind of circle that's very difficult to break.
Escape the food.
Exactly.
Yes. Okay.
Yeah.
And we want to know that, we want to understand, like all of the people know that food is the only source for our vitamins and minerals, which are vital for everything, even the beauty and the skin health, and everything requires healthy and good nutrition. So when it comes to probiotics, we said, and supplements, is there any role of probiotics in irritable bowel syndrome? And we'll speak about other supplements, if any other medications to support this condition.
Surprisingly, very little supplements, and this is why I covered this in depth in the book, just because there's so many supplements out there, and isn't it useful, isn't it amazing even to be able to pay X amount and all your bloating will just disappear. And unfortunately, there's very few actually have research-backed, outcomes with them. But probiotics can help. But what we need to be doing is looking at what type of strain is being used in that probiotic, because probiotics have a strain-specific effect. So that means that there might be a type of bacteria, and that's been shown to help with constipation, but actually doesn't work for diarrhea. It's been shown to help with constipation, but maybe not IBS. Been shown to work in pediatrics, but not in adults. It's very, very specific. So when we go into that pharmacy and we just buy any random probiotic on the shop, probably won't do any harm, but it's probably not doing anything in your gut. So I'd say if you are looking at a probiotic, look at one that has got research behind it, show that specific probiotic works. I have seen some companies being very sneaky and sort of putting lots of different bacteria together to say, oh, look, it has research for depression and IBS but actually when you put all the bacteria together, they can then start interacting. So they don't really give you the same outcome. So you need to find a probiotic that has got very specific research. And the other thing I think that's overlooked in this region is we have a really hot climate here. And probiotics to be alive need to be kept in a room temperature or sometimes even refrigerated. So often the products we're getting through maybe even, I don't know, but like Amazon, for example, maybe they're dead by the time you're even having them. So you need to consider where are you getting it from. And I know when I first came to the region, we were setting up the pharmacy and helping them with different strains and things. And one of the questions was, well, how are these being imported to us? Because what's the point in giving, patients if they're dead? So it's very difficult.
Yeah, it's very difficult with probiotics. Even for me, this is the only concern when it comes to probiotics, because also in pediatrics, we use them for diarrhea and for other, also sometimes they can support the treatment of constipation. They are not the treatment, and for other conditions like functional abdominal pain, however, also for colics. But we use the strains only that are identified. And as you mentioned that there is research behind them. But the company should be reputable also, and the storage and the number. Really big, very much details, and I don't know if many brands qualify into this criteria. So what are the supplements that can help in alleviating, let's say, the symptoms of irritable bowel syndrome, including probiotics?
Okay, so yeah, some probiotics can definitely help, but just check that the strain is specific. So it's been shown to actually help with IBS, because it might have been helping with nothing, or it could be helpful for oral health or for pediatrics, but it's not going to help in IBS for adults. So make sure it's been shown to help with that, with research behind that. The other supplements then that can help is fiber supplements. So psyllium husk is one. So psyllium husk is ironically very cheap on Amazon because some of these supplements are very expensive, but it's good for both constipation and diarrhea, even though it's a fiber, because it helps bulk up the stool and make it nice and soft. But even for diarrhea, it would bulk that up and slow it down as well. So it's very, very good. And you can add that to water, have it twice a day. It's fantastic. Partially hydrolyzed guar gum is a type of fiber as well. Works very similar to psyllium husk. And then the other one that I use quite a lot is peppermint oil capsules, which are almost like a natural pain relief, I guess. They block the pain signaling. So for anyone getting cramps, it's worth trialing this as well. There are a number of supplements on the market, though, that claim to do X, Y, and Z, that have different herbs and things in them, and they just have no research behind them at all. And unfortunately, some of them are very expensive as well. So people are taking these. Best case scenario, they might get a placebo effect, which we know can be up to 50% in people with IBS, but they don't have any research behind them. So really the ones that I would advise on would be those fiber supplements, and then also looking at peppermint oil capsules.
Okay, great. So mentioning probiotics, I would like to support the idea that people should look for the strain and look for the research behind it. And as we said also, as we always say, like the storage, the number, lot of things and details to be considered when giving probiotics to people. We face the same in children when it comes to also the GI disorders. So prescribing a probiotic is not just, you go to the pharmacy and buy something. It has to be prescribed by the doctor because he knows more about the strain and about the research and about the company, the manufacturing company also. Also earlier you mentioned FODMAP diet. What is FODMAP diet?
Good question. So the FODMAP diet is a diet that's low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols.
What are these? Give us real life examples.
Yeah, so the
because I was reading these and I want to know people need to know what are these.
Absolutely, because there's so much jargon in that.
Yeah.
But essentially, these are different types of carbohydrates that we find in different types of food. So, for example, lactose is a FODMAP. We find that in some dairy products. You might find
that's why dairy is not the best when it comes to irritable bowel syndrome?
It depends on the person.
It depends on the person.
Yeah.
Again, yes.
And this diet is what really, finds out what somebody is actually triggered by. So other examples would be fructans, which is another type of this carbohydrate we find in onion and garlic and bread, which I'm sure some people listening will be relating to, going, oh, okay, that's why I now react to that food. But what we do with these carbohydrates, because we don't know from the outset what's causing the issue, is we actually take them out of somebody's diet for 4 weeks. So we have a really low FODMAP diet for 4 weeks. And then at the end of that 4 weeks, we bring them back in one at a time to find out, number one, what is actually causing the issue, but then number two, how much can they actually have? Because we're talking food intolerances, not allergy. So somebody might be able to have, for example, a couple of slices of bread per day, but they couldn't have bread for breakfast and lunch. That would be too much. Or perhaps they can have a little bit of dairy milk in a coffee, but they can't have it on their breakfast as well. That would be too much. Right. So it's about finding the real specifics rather than just having this restrictive diet.
All right. So carbohydrates like those present in dairy products, and in you mentioned bread.
Yes.
And some onions and garlic.
Yes.
And what else?
Things like apples, pears, so a lot of the fruits, some of the vegetables like broccoli, cauliflower.
Although these are healthy food and good food.
Yes, exactly.
But can be triggering.
Yes. So because how they cause a reaction in IBS is, then this is why they're also healthy foods, which is very confusing, is they actually end up all the way in your large bowel, which is a bit right at the end of your gut. And in the large bowel, this is where there's lots of good gut bacteria, and it starts to break it down. That creates gas. So in people with IBS, it creates too much gas, so it could cause bloating and pain. And also your body likes to always be at a certain level all the time. So when it finds all of these foods suddenly in that part of the bowel, it draws in water. So for some people, they can end up with loose stools. And interestingly, the research shows that these FODMAPs cause a similar reaction actually in everybody, but in people with IBS, they will often react more to even normal digestion. Okay. So you might even
overreactive bowels.
Exactly. And there's actually a really interesting study, strange study, but interesting study that if anyone wants to look it up, where they actually get a really teeny tiny balloon and they put it up the rectum of somebody who doesn't have IBS versus somebody who does have IBS. And that person with IBS, they feel it and they feel pain a lot sooner than someone who doesn't. So that person's gut is very sensitive to even to normal.
Yes, sensitive guts, yes. So in any chronic disease, there are periods of remissions and periods of relapses. Is it the same for irritable bowel syndrome? Do these people have periods where are symptom-free?
So not really. It is a chronic condition, so they're not going to suddenly go away. It's not like inflammatory bowel disease, for example, which causes real inflammation in the gut, and then it will randomly sometimes just go into remission. So it's not like that. It's always there. But what I would say is with my clients, we get to the point where we've worked their gut into a really good place. So it's not as sensitive.
Yes.
So can they go and party all week in Ibiza and have no symptoms? Probably not. But they can have a good lifestyle and live relatively symptom-free once they know what their normal triggers are and they're following a good regime. They won't just randomly suffer with symptoms.
When you are ready to tell the patient, it's okay, you don't have to come for the follow-ups,
Yes.
You're fine now, and does this happen often? You have successful stories, or it's a long time journey and that's it?
No, so I am quite strict on this. I only work with people for 3 months because it takes that long to find out what the triggers are, build their gut back up to where they need to be. And at the end of 3 months, I don't want to see that person again. They're finished because they know what to do. Their gut is in a really good place. They have significant improvements and they also know what to do in the future if it does flare up. And sometimes it can because life happens. You know, we go through stressful periods. Something might change. Perhaps somebody gets pregnant, hormonals change.
True.
And this can impact their gut. But they are in that position that they know so much that they're able to then manage it themselves.
Great. Are there stages in life that are like, for example, menopause, adolescence, where you can have these things more? Because we mentioned stress, we mentioned hormones, we mentioned lifestyle, so pregnancy, as you said. So do they flare up, the symptoms flare up during these stressful conditions?
Yeah, it's interesting actually. So when I ask my clients, when I'm assessing them, one of the questions I'll ask is, when did your symptoms start? Because sometimes if they think they have IBS, but they actually were born with it, that you're not born with IBS. So that can be a sign that maybe they have a food allergy or something else going on. But typically IBS starts around the ages of 20s. So I often see it when people first go to college, which is a really stressful period for us at that time. And obviously we then realize as we get into adult life what real stress is. But during college years, it's a lot of change. We're trying to get through our exams and we can put a lot of pressure on ourselves. And this seems to have an impact, sadly, on the gut. So typically around that. Then also pregnancy can be really hit and miss, interestingly, because people worry. They think, oh, maybe pregnancy will make my gut worse. Some people, it seems to make it better. And we don't really know why. But it is very common in pregnancy to suffer with constipation. So it's just about letting that person be aware of that so they know how to avoid it. But typically then when baby is born can be an issue because you're not sleeping. It's a change in your lifestyle, change in your relationship even, finances, and that can then trigger things.
Yeah.
And they can't just take themselves to the gym on their own because they have now a baby to look after. And then also during menopause. So menopause is sadly, but not surprisingly, not very much research during menopause and IBS. But I see a lot of people where they're just trying to get their HRT correct. They're not sleeping at night, they're having night sweats, their mental health unfortunately declines, and all these things can impact the gut. But interestingly, the rate of diagnosis in IBS actually drops down post-menopause.
Oh, cool.
So there is a theory.
That's great.
Yeah, there is a theory that it's related to estrogen, and that's maybe why like more than double the amount of women get diagnosed with IBS than men.
Yeah, but I wanted to ask you. So women are also more affected, like osteoporosis.
Yes.
Always we have the majority of the cases as women.
Everything. We have the periods, the
Everything,
babies,
yes,
the
yes.
menopause, osteoporosis.
Everything is double with us. Yes. All right. So lifestyle basically is now also many people are speaking about it. It's important for longevity. It's important for health in general. It's important for mental health. It's important for physical health. It's important for for success in life. It's mandatory. It's important for happiness. So when it comes to irritable bowel syndrome, of course. It's very important to have a good lifestyle. When we say lifestyle, we mentioned diet, we mentioned exercise and the importance of sports in alleviating stress and in alleviating symptoms of, by that, the symptoms of irritable bowel syndrome. We get to the sleep, the third pillar in lifestyle, in a good lifestyle. So we know that people should get at least 7 to 8 hours of good sleep in 24 hours. How does sleep affect patients with irritable bowel syndrome?
Yes, thank you so much for bringing this up, because people think it's all diet, and sleep is one of the most important factors in gut function. So we know sleep is directly impacting the gut in a number of different ways. So we know people who have poor sleep, which is a very general term, but lack of sleep or the quality of sleep, their microbiota is different. So we already know that, and that's in a general population. But then imagine if you've got IBS, so your gut's already disrupted. This is going to impact it worse. But we also know that the number of night waking, so if you're waking up during the night for maybe there's a pet that's waking you up or a snoring partner or something like this, we know that that's directly related to the number of symptoms you would get during the week. And then probably the most interesting one that I've found with IBS is the lack of sleep can actually reduce what we call the stress threshold. So that means that say you have a bad day that day at work and you had a really good night's sleep last night, you're actually able to deal with that pretty easily. Not, or maybe not, depends on how bad it is, but fairly easily. You don't feel overwhelmed. You don't go into what we call the fight or flight pathway, which is where our body gets ready to go, and it becomes anxious and it can impact your gut. However, last night, if you didn't sleep well, that same scenario will send you into that fight or flight pathway. So you might notice your heart racing more, you feel a bit nauseous, but this, in people with IBS, can actually trigger symptoms. So actually, if you think about getting back to a sort of a normal lifestyle where you don't have to be so careful about everything you eat, everything you do, if you could actually just guarantee you sleep better every night, your gut's going to be more resilient. So it's really, really important. And I think people think, oh, it's just about getting an early night. And it's not. It's about the quality of that sleep as well.
Very true, very true. And very well said. But I want to ask you final words on lifestyle also. What do you tell people about caffeine and coffee? And let's be realistic, we all need it. The other thing, people who smoke and people who drink alcohol, what are your advices in general for those who have these habits in their lifestyle and they also have irritable bowel syndrome? What do you advise them?
So first of all, I think it's good to get educated, to know that all these things impact it. And then I would say you've got to be realistic, because it's all very well to sign up even to work with someone like myself and you're going, yes, I'm going to give up everything and I'm going to be in bed by 10 p.m, etc. But you need to be realistic. So in healthcare, we always talk about SMART goals, which is about specific, measurable, achievable, realistic and timely. So look at your vices or your things that you need to change and just think what's realistic. So I do have some clients who are like, look, I really want to target my smoking because we know nicotine can have a huge impact on the gut. In fact, there's a study showing that people who gave up smoking, it reduced their symptoms by 27%. So that one factor. So some people will come to me and say, I just want to give up smoking. It's been on my mind for a while. And then we need to then work with someone specialist in that, whether it's a psychologist or someone to get you help. It's not realistic to just stop this on your own. Other people, though, they would rather just be like, right, I just want to cut down everything a little bit, which is a bit more realistic. And definitely there are some myths around things like caffeine, for example. So people think they need it. But the irony is if you have the same amount of caffeine every day, your body becomes used to it anyway. So you're no longer getting this kind of caffeine kick. You're just having the stimulation of maybe your gut, the lack of sleep and things. And also caffeine can actually stay in your system for 10 hours. So you might be waking up in the morning, you need to get to work, you need that caffeine because you're so tired. But the irony then being that the caffeine then you have to have all day is stopping you from sleeping at night. So it's about becoming educated, looking at like what's actually realistic. I think there is a fear when someone works with a dietitian that you're going to say, right, no fun, no, like absolutely
imbalance,
nothing.
Imbalance.
Exactly.
I think everything should be in balance. So, okay, and there's a question, maybe as a dietitian in general, I want to ask you about the benefits and probably unbeneficial side of dairy products in general, not only on people with IBS and including people with IBS also, and gluten. For the normal people, let's say, we start with the normal people. Do you advise them to consume gluten? Do you advise them to consume dairy products, and how?
Yes, I advise them to consume the normal people without IBS. Dairy and gluten are absolutely fine. They both have been demonized in the media, on social media, and for a number of reasons. And even gluten is quite an easy one to demonize because most people, we eat probably too much bread. That's a problem. So as soon as you cut it out, guess what? probably do feel better because you're eating healthy, you're maybe reading labels, you're cooking from scratch. But it's got nothing to do with gluten, because gluten is just a protein that we find in wheat, barley and rye. The issue being is if you take it out of your diet, then your diet becomes less diverse, and we know that will have a negative impact on your gut and also your wider health. So gluten is absolutely fine. And it's quite sad because I actually have celiac disease, so I can't eat gluten. And I see all these other people that can eat it and they're eating gluten-free stuff, which is awful. So gluten is absolutely fine in the context of a diet. The same as dairy. Unless you have, as we'll talk about in a minute, lactose intolerance or a dairy allergy, there is absolutely nothing wrong with dairy.
Right. But also because we eat a lot. If you think about dairy, I think, because everything has milk inside. The bread, the cookies, the cakes, the coffee, everything. So that's why maybe the excessive amounts that we are consuming is causing us this discomfort or the symptoms we are feeling. Very nice and great. So now, Kirsten, I will ask you to send a message for the people who have irritable bowel syndrome and tell them what are your insights and your advice. And yes, what do they look for? Is there any hope?
Yeah, absolutely. If you're suffering digestive problems, this is absolutely not normal. It's not okay for you just to continue along. Most people I work with, they actually get quite shocked when their symptoms disappear because they're quite sad, they've had it for a number of years. And then actually they realise I didn't have to suffer with this. So you do not need to suffer. You're not a medical anomaly. We just need to apply the research to you and your situation to get to the bottom of what's going on. So if you're listening to this and you've got symptoms, go to your doctor, get some routine tests done to make sure it's not something else. And as soon as you get that diagnosis, reach out to a specialist dietitian to get your life back on track, get rid of this. You do not need to suffer with it.
All right. And some dietitians like you have a clinic online.
Yes.
Yes, that's very interesting also. The last question in this discussion will be about your book, Take Control of Your IBS. Why did you decide to write a book for these patients? Is it that they are suffering so much, or you want to reach the biggest number of people? Why you wrote a book about irritable bowel syndrome?
Good questions. I've actually brought you a copy.
Just
so you can have a look yourself.
Oh, thank you so much.
But
this is the book, Take Control of Your IBS. Yes.
But yeah, good question, because there's actually quite a few books on gut health in general. But what I found in the market is that some of them are really outdated. They don't talk about IBS specifically, or they're by maybe doctors who are fantastic at what they do in diagnosing, but they don't have the experience actually managing this condition. So they don't know the ins and outs of the diets and things. So there was space there that they needed to be done to rewritten this book. And also,
so there was a demand.
Exactly.
Yes, for this book.
And also, a lot of people don't have access to a dietitian. Maybe they can't afford it, or it's not covered by the insurance, or they just don't know. They may be living in a country where it's just not available. And a book is such an easy thing to be able to order, online or pick up from a bookshop. And it's got everything in it. So it's almost like the Bible for people with IBS, in that it covers everything from getting that initial diagnosis to long-term, to even dealing with relationships even, because all these things can become really tricky. So it's not just another diet book. It's got everything. And I actually consulted even with a physiotherapist around pelvic floor health on it, and then a psychologist. So
it's a platform.
It's
a multidisciplinary team.
Exactly.
Yes. The step-by-step guide that actually works. However, this can cause long time suffering for those who have it, and it's as important as any other disease, and we need to take control of it and of the symptoms that come from it. So this book, I like it so much, and I'm sure there is a lot of demand because as doctors, yes, we focus usually on just the disease, and many conditions can affect our life massively, and still they are not, let's say, major diseases. However, the day-to-day life is the important thing at the end of the day. That's why we say the aim of this podcast is to improve the health with science of people in day-to-day life. So Mrs. Kirsten Jackson, thank you very much for being with us in this podcast.
Thank you for having me.
Thank you.